Hi, everyone. My name is Steve Lawson.
My name is Anja Fofana.
Welcome to the SIGNA Masters live scanning sessions, where we're highlighting our intelligently efficient solutions. So today we are live from our global headquarters here in Waukesha, Wisconsin, and we are in our SIGNA Voyager bay. So we've had some recent innovations, particularly with this system around the new coil technology with air. So we thought we would highlight that with you today, as well as talk about that with some of the MSK imaging.
Yes, and we are really excited to show you today the air coils on the Voyager scanner, and we just want to go over and show the coil itself, what it is all about. So here we have the Air A coil available for the Voyager scanner, and you see it is the same as you hopefully know already our other air coils, that it looks like a blanket and it feels like a blanket. So you can easily twist and turn it around as you know maybe our other air coils as well. It's really, really flexible, and that is why we are so excited to scan with these coils also on Voyager, because that really opens up so many opportunities, especially in regards of MSK scanning, which was always really struggling for an MRI tech before.
Yeah, typically when you would have a coil and you would overlap the elements so close, they would detune and decouple. But with this technology, we don't see that so much. So it really allows you to be closer to the anatomy. So if you're doing a long bone, a joint or something like that, and you wanted to get the coil closer, that's going to maximize your signal to noise. And then you're also going to be able to use really great parallel imaging accelerations with this coil to reduce the scan time and increase your productivity as well.
And all the other rules apply with this coil as well. So for example, you can use it in combination. So thinking about the combination with the embedded PA coil is no problem. So you can use signal from posterior elements on the table. Anteriorly, you can use that coil. You can even combine multiple coils. So here we do have the second area coil. And what just Steve mentioned is that there are no really rules applied to that coil and how to position them. So you can overlap those two coils as much as needed. So you can have really a large overlap or a small overlap. Anything is allowed, and always will give you a really nice image quality.
Yeah, and these coils have a lot of coil density, so there's many elements inside of the coils. So from a user's perspective of being able to select the appropriate coil while they're scanning, it's pretty seamless, actually. The user interface just select the icon that you're scanning, the coil you're scanning with, and that's really it. And based on your field of view, where you're scanning through the coil, it appropriately turns off and on the coil, and it does so really intelligently. So maybe you're using a certain parallel imaging factor that the system's trying to achieve for you to get a shorter scan time. It can accommodate elements within the field of view and allow you to get the accelerations that you really want.
Okay, so we have one of our co-workers ready for you guys to show you some positioning and what our ideas and how to utilize this coil. We just want to let him hop on the table first, and we want to show you some ideas around maybe for your real life for spine imaging. So maybe your patient is coming in and tells you, oh, I cannot lay on my back, I'm so much in pain. So now with the scanner, you have a wide table, you have the air coil, you can just tell your patient, please find the position however you want on the table. So I will ask him, maybe go on your side. Yeah, just head first, and yes, just on your side, and you're first like this, and find it comfortable. So maybe he can cuddle up like he would be in his own bed. So then we can just put this coil around him, and you can see you have all the elements available on the spine where needed, and that is a positioning he might tolerate for the next 15 minutes to do a spine, which is really, really nice and convenient now. So another thing which is really nice with these coils, if you have a long bone scanning, so for example, you want to scan the humerus, you can ask your volunteer or your patient again to go on his back. Maybe we will ask that too. And now we don't have to think about where the pathology, if it is maybe in the shoulder or the elbow. Since we have this large coil available, I would just go ahead and wrap that around entirely through the arm, as you can see here. And you see that we have coverage starting in the shoulder, goes all the way below the elbow. So now you can have your large field of view bone, and finally you can like display two joints in one skin, which is really, really huge. I think.
Yeah. Humerus has always been a challenging exam in MR, and I think just rigid coils don't give you that flexibility to be able to have great coverage around the anatomy. So it's a really great solution for that.
And then for sure, I just want to show you before we like really start with the live scanning session, for abdomen scanning as well. You see that you don't have to use any straps when you scan an abdomen, because this coil is really, it doesn't look like a blanket only, it feels like a blanket. So when you put it on top of your patient, it will fall down and really like fits the anatomy perfectly, that you don't have to worry about like bringing the elements closer to the anatomy. It's already happening by nature, right?
Yeah. And you can scan with this coil, maybe if your patient is really large, but you wanted to scan with it maybe in another direction, you can easily just rotate the coil to get a little more coverage in the Z direction to give you just a little more coverage with the anatomy that you might need.
And the good thing is you don't have to let the system know how you position the coils. Since we do have an air touch on the scanner, which is our new tool to recognize coils, we are creating all the sensitivity map before we start the scan, so the system does exactly know how the coil is on the patient and will understand how to turn on the elements needed for making and providing the best image quality. Okay, so that's just some ideas, and now we want to do maybe a long bone scan on the leg. So I will ask Mike again to get up and then maybe go in feet first, and then he finally gets also a comfortable pillow from us. Because we treat our coworkers most of the time nice.
Always.
Okay. And then I will, when we just want to maybe go with the leg. So just go with your hand over here. Perfect. And also here you see that it nicely covers the ankle until the knee without any issues, which is really, really convenient. And then I just wrap around the coil, and as Steve said, I don't have to think about like overlapping too much or too less. I can do whatever is really doable on that particular patient. So if I want to overlap more and really do that strict, then I can do so. Okay, perfect. I think it's comfortable for you, right? Okay, and then we just go ahead and start with the exam. I will give him the squeeze ball. We do
the lower legs here.
Mm-hmm. Okay.
Here we go. It's fine.
Okay, now we are back on the user interface where you see that we already selected the protocol, and we just go ahead and start the scan.
So we encourage, if you have any questions, please put them in the chat, and then we can answer any questions while we're sitting here talking about this this new coil and scanning.
Yeah, it's really the biggest advantage I really have with the air coils is that it's so easy to put them on the patient and to fix them on the patient and have coil elements close to the anatomy. That's really the biggest advantage. Okay, we scanned the left one, right? Let me see if I want to have another. No, I think the localizer is already good enough for me. So I just go ahead and start with the first field of view. So I'm running a sagittal
view here, and I want to cover the entire leg, and you can see I have a large field of view. So here you see the coil coverage offered on that particular anatomy. You see that we have really an entire coverage of the knee and until the ankle. So it's really a large field of view which is offered here, and I can cover 2 joints in 1 scan. And I will want to run this first sequence in a stir contrast, and then I do exactly the same with the T1 contrast. And then we can see how nicely the images turn out.
Okay.
One other thing maybe which we want to highlight and which we want to mention is that we don't have to think about which coils to use. What we do here is happening in the background was a coil calibration. So whenever the scanner is running a localizer scan or another scan where we put new coils in consideration, it does create a sensitivity map. So a sensitivity map means that we turn on every single element of the scanner, and we do turn on the coil elements in that field of view.
Yeah.
So the technologist doesn't have to think about which modes to activate, which coils to activate. The system does that all automatically because the software does. And what happens, since we have a touch on the scanner, is that there are way less mistakes made. Even if you are a long experienced tech, you sometimes forget to really turn on the right coil elements because maybe your phone is ringing or your patient wants something for you. But with having a touch in the background, I can really focus on the most important things.
Sure, yeah. It's a really nice feature.
Okay. Maybe while this is running, we want to look at the first images which we've seen in the field.
Sure, yeah. So we've got some cases I'm going to pull up here of some examples. Let me start with this one. So, one difficult exam historically is like a sternum. This is a sternoclavicular joint. Wanted to highlight, this is with the patient breathing. It's likely that, traditional imaging would have a lot of motion, artifact on those, but we can use propeller MB, which is a new technique with propeller that allows us to get excellent results, and we can even maintain T1 weighting. And you'll notice the TR and TE and the echo train all are shorter values that allows you to maintain your great T1 tissue contrast. So I think there's some great image quality there with that. And then also you can do all kinds of different contrasts with it in addition to T1 and T2. The example on the bottom left here is a stir. So I think you can appreciate the resolution and quality there with that. And then they also had done the same scan here on an axial plane. So propeller P1 for 3 minutes. The stir here, this is a traditional stir, non-propeller, but you can see really nice SNR and great image quality. Alerta Plummer asks if how many elements or channels are in the air coils. So this particular air coil has 16 channels in it for this system right now. For the other systems, the 3T systems and then the Artist system, we have a 30-channel anterior array air coil. So.
Another thing which you can really appreciate here when you look at the SC joint or the sternum is that the air coil has it goes as close to the anatomy as needed, and that is really important here. Thinking about your patient's status, that they might have a big neck or that they have a tiny neck, and sometimes it's really hard when you work with bulky coils to get coils as close to the sternum as possible because maybe the shoulders are going up or maybe his neck is really big. With the air coils, you don't have the issue anymore because you can really pull that coil as close to the sternum as needed.
Or even, the patient could have a lot of pain, right? Having a lightweight coil. These coils are 2 kilograms, I think, with this particular coil. So that's going to be a lighter coil, better experience for the patient themselves. So
less complaints for the technologists.
And we've heard our customers tell us this as well, like patients that have had many MRs, they'll say, wow, that was a very different experience this time. So patients are even commenting on how much better it is too. So that's a great thing. So another difficult exam in that region is neck imaging. So here's an example of a brachial plexus. I think those have been kind of a challenge, but this allows us to get the coil closer to the anatomy to get better results in this way. We're using Cube here, and you can do Cube with Hypersense to reduce the scan time. Hypersense is a compressed sensing technique that uses data sparsity to accelerate the examination much faster. And then you have Hypercube also being turned on. So we're reducing the phase field of view a bit there, and you don't have to be so concerned about wrap. So you'll notice the phase field of view is kind of cut in this direction because we wanted the extended Z direction. You don't necessarily want it right to left. So that's pretty advantageous, I think, in the end, because it can help reduce scan time too. And you get great results where you can track the nerves all the way down, into the past the lung fields and down into the humerus. So that's great. And then this example is a LAVA acquisition. So for maybe you want to do a gradient echo, post-contrast or something like that. So this is a nice way to do that too.
And we want to be quick. When we look at the scan times for the lava flex, it only took 2 minutes to acquire. And you can use the Dixon technique again, which allows you to have homogeneous fat suppression.
Yep. And then you'll get the in-phase and out-of-phase fat image also. Yeah, so that's really nice thing there. Here's an example, also just to show you an example of a couple different planes here I wanted to highlight, but this is a stir of the humerus. So we're wrapping the coil around the anatomy, getting really close there. So 3-minute acquisition for this, 3mm slices. And if you'll notice the resolution on this one, we're doing 768 by 400 resolution with a 3mm slice. And you'll note that the scan time is only a minute here, so 1:06. So these coils really do give you that acceleration that you would need to be able to get a rapid acquisition. So that's excellent. Another example here. So we were just trying to play with the acceleration. So this is the same thing as that other scan I showed you, but we were just accelerating maybe like a factor of 1.5 or 2, where the other one was more like a factor of 3 or 4.
And we saw that the image quality stays the same with even accelerating higher. So that is why we are always accelerating really high now.
Yeah, exactly. And then a new technique that we have, this is a 0 TE acquisition to see cortical bone. So very interesting here. So this is a 3D volume. One thing to note that this acquisition is entirely silent. So the gradients are not ramping off and on very rapidly, making a loud noise. So it's a silent acquisition. This is 1:47 seconds, and we're able to get really great information here with cortical bone, kind of a CT-like image, if you will. So this is a really cool thing. We're able to take this as a volume, and then you can, maybe in certain cases where you might want to 3D print these volumes, you can 3D print them and get great images of the bones, which is unique for this particular acquisition, because we don't usually see that much detail in MR with that. So
okay,
kind of move over here. We'll let you see what Anya's doing.
Yes, so we acquired the first sagittal planes. The first one was the stir, the second was a T1, and they are all finished now. So I want to go here into the quick view and show you the results. I split here my layout that we can appreciate really one image by one, and I will zoom in and see how nicely we cover the knee joint and the ankle joint really in one field of view. That is, I think, something which makes every life easier now.
Yeah. So there's, some cases where you're imaging the ankle where you want to see the Achilles insertion, and maybe the patient has a torn Achilles and it's retracted. This allows you to, just have the flexibility and freedom during the scan. You just set up for an ankle. We have some immobilization devices you could use for an ankle and just wrap the coil And then you'll have enough coverage also to go up to mid-calf easily and be able to see a retracted tendon and something like that.
And it's really nice for all these patients coming in when they have like unclear pain, where you never knew where you want to scan. And now you have really the option to like, do one scan and cover the entire leg. Here is an example of doing it in a coronal view. See nicely, the knee is displayed. And we go all the way down. All scan times are really like cut short because we can accelerate high with these air coils. Here's an example of a 2-minute scan. And a last thing which we really want to emphasize is the new software helping us for the coil pick, which we call Air Touch. So here on the user interface, we are just selecting the entire coil. And here I just want to show you in a coverage where we have less S2I coverage, how nicely and precise this new tool works. So on the sagittal view, you see here the coil positioning, and the gray line shows where the coil is on that leg, and the blue shows which coil elements are selected by the software. So when I move my field of view around, you see in a second, it just changes the pick. And you don't have to worry about like really which coil elements to turn on and to turn off. The software does exactly know which coil elements gives you the most signal, which has the most noise, and really only selects the coil elements needed and making the best image quality. This is something I appreciate on my daily work so much, because it never happens anymore that you are scanning for 2 or 3 minutes and you might see like images where you haven't selected the right coil, correct?
Yeah. So that makes it a lot easier for sure. Once again, if you have any questions, feel free to ask in the chat. Got a few more minutes here.
We are just running now an actual view of PD fat set, also like a fast scan, 2 minutes, 16 seconds.
Harvest. Nada.
Hello? Okay.
So here the actual PD fat set images, and you can see that is why we did that scan, that even though we scanned large field of views at the beginning, there's not a problem here to switch like to small field of views. And that is really like thinking about like all these pathologies where you don't know where to scan. You can start always with a large field of view, and if you see something happening, then you can really focus and go with like small field of views. Here's a 16 field of view, and you can go even smaller. So that is why the air coil gives you all the opportunities to really have an easy scanning session, I would say.
Yeah, I mean, I think historically a lot of times customers thought when they were switching coil from a dedicated coil to something that was a little more patient-friendly, like a flex coil or something like that, that they immediately thought, well, I'm not going to have the signal I have with my dedicated coil. Let me adjust my technique. And I don't think that's really the case a lot of times with the air coils. It allows you to maintain the resolutions that you're typically, you've been scanning all along. So you can note here that it's really nice. Small field of view and great resolution too.
Yeah, and switching from small to big doesn't involve any repositioning of the patient anymore. You can just do it with one coil, which is like really helping you on the daily work.
Absolutely.
Okay. Let me do maybe one more scan to set up. We want to maybe show one more Dixon technique here, which is also available on all of our sequences. In that case here, I'm running again maybe a coronal view where we have a T1 contrast with Dixon. And then we can show you.
In here. So I'm going to show you a couple of examples here too of a spine scan on the cubitus with the air coil. It was on the SIGNA Artist, but this is where the patient or the scan subject was scanned on the SIGNA Artist with the air coil. It's a slightly different version of the air coil, but nonetheless, the patient is in a comfortable position. You're able to put this directly on their spine and image them this way. So we're starting to see a lot of interesting ways customers are using this in the field to demonstrate that. It's all about working and improvising sometimes with what your patients can accommodate. We realize that. So this offers you a great solution.
We've even seen like really customers using the air coils for doing a brain scan. In case somebody's coming in and is really injured and you cannot fit them in any other coil, then you are even able to wrap around these flexible coils around the brain as well.
This is an axial 3D volume, so and sagittal propellers. Different fields of view there, just so you get an idea how that works. So, all right, we just have a few more minutes left in the session.
Maybe there are some more questions from the audience.
Maybe while we're waiting, we could show something else about the coil, maybe just some routine abdomen imaging that the coil actually can do well. So let me pull up another case here.
Okay. So I just saw the question in the chat, and here is the example for the abdomen, and the person who typed in the question guessed right. So we do have the signal anteriorly from the area A and posteriorly from the table, which where the coil element is embedded in the table.
So that's with the 16-channel air coil. Let me pull up another exam here. So this is entirely free-breathing abdomen. So this couple of examples here I can show. Some abdominal imaging. All free-breathing. So free-breathing abdomen exam. Here's an example of a non-contrast renal MRA. Turned out very nice with the air coil. Diffusion, MRCP. You can see nice results here with the MRCP. So it does even great abdominal pelvis imaging as well as MSK. So we feel like the coil performance has been really good, and we've been really impressed with how that's turning out. So.
And here's the last scan we just did. That was utilizing the Dixon technique. So we get per slice 4 different image impressions. So that we get the water selective, the wet selective, the in phase, and the post phase. You can do that in any contrast. Here in that case, we picked the T1 contrast. And you see that you have a really large field of view scanning again with nice wet selective images, which is an easy way to do now.
Yep.
Okay.
All right, great. So tomorrow we do have another session. So we hope that you guys will join us for that. Should be really interesting. We'll be highlighting some more intelligently efficient solutions that we have and our latest innovations. So once again, thank you for joining.
Thank you so much. Bye.
Thank you. Bye.